Thank you for the opportunity to speak with you today about Bill 84. I trained as a family physician and have worked in Toronto for over 30 years. I've been providing MAID to patients since July 2016. With Dr. Ed Weiss, I co-founded MAID GTA, an organization of assessors and providers. We also have a website available to the public through which patients may self-refer. I'm also a member of the Canadian Association of MAID Assessors and Providers, which is a national group. Today, I want to share with you some of my experience as an assessor and provider of MAID with particular reference to this bill. I am a third-party assessor, meaning these are not patients from my medical practice. They are referred to me specifically for MAID through the Ministry of Health Registry, other MAID assessors and providers, their physicians, or their self-referrals. I appreciate and support the amendment which protects the physicians, surgeons, and other persons assisting in the provision of MAID from a court action for damages unless he or she is negligent. The amendment that ensures that a person receiving MAID is not denied life insurance or other benefits is also good and will be a relief to patients. To protect the safety and privacy of those participating in MAID, the amendment disallowing freedom of information requests for information identifying individuals is very important. Fear of exposure and of harassment by those opposed to MAID is very real and may deter potential providers from providing MAID. However, I do not think this protection should extend to institutions. Publicly funded institutions should be accountable and transparent, and the basket of services they provide should be readily available to the public they serve. This includes MAID. Patients cannot make informed choices if they do not know the policies and services provided by institutions or how those policies may adversely affect them by creating barriers to care. The amendment to the Coroners Act to require reporting of MAID deaths to the coroner does not serve the public in the long run. Data on MAID deaths should be tracked for statistical purposes, but we would be better served by a national framework. MAID deaths are planned and medically indicated, not sudden or suspicious, so there is no need to involve the coroner. Patients and their families have been frightened and faced further anguish and insecurity, knowing that these deaths are reportable and thus could result in an investigation with an autopsy. For physician and nurse providers, the nurse practitioner providers, the paperwork and time involved in making these reports is excessive and unnecessary. The addition of a tick box for MAID on the death certificate should suffice. This would also facilitate removal of suicide as the cause of death on the death certificate, a label which adds further insult and stigmatization for the patient and their families and loved ones. I understand, and I've heard this afternoon already, that there is considerable discussion about conscience rights as the bill was going through second reading and currently. At present, the College of Physicians and Surgeons of Ontario has a policy regarding MAID which includes the requirement of effective referral. Even with this policy in place, over half of the patients that I have seen in the past 9 months have suffered from lack of effective referral, meaning their requests for MAID were not acted upon in a timely manner. I can only imagine how bad it would be if there was no policy requiring effective referral at all. 2 patients whose physicians did not refer them contacted the BC Civil Liberties Association, which they had heard about in the media, and asked for help. Through a physician in Vancouver, they were then referred to me, but this resulted in delays of many months for these patients. 2 patients made suicide attempts, trying to end their own lives when their physicians did not act on their requests for referrals. This led to further delays due to the subsequent refusal of referral on mental health grounds. This was totally inappropriate under the circumstances, as the patients were not clinically depressed and they had full capacity. Some physicians tell patients to find their own assessors, go online to find out information about MAID, go online to get the forms, etc. These are very ill, fragile, frail, vulnerable people, many of whom do not have the wherewithal to do these searches, some of whom are physically incapable of using a telephone, let alone a computer. To ask them to do this themselves is tantamount to patient abandonment. It is also cruel, imposing a tremendous burden on an already vulnerable person. Not all patients will have family members or friends who can help them navigate the system or advocate for them. And if they do, these advocates can be accused of coercing the patient. The patient is then deemed ineligible for MAID due to presumed external pressure or coercion. This is a terrible bind for the patients and their loved ones. The issue is not just effective referral, it is also effective and timely response to requests for medical information that is needed to make a proper assessment of eligibility. I have received referrals from the Ministry of Health Registry only to have the referring doctor not return phone calls, not follow through on sending necessary information, again leaving the patient languishing in pain and uncertainty. In 3 cases, patients' family members went to physicians' offices themselves, picked up the records, and delivered them to me. This requires a level of assertiveness and tenacity that not all patients or their support people will have, and is an undue burden on them. When patients self-refer, I still need the assistance of their doctors to obtain medical records and information as part of the assessment process. Doctors and hospitals make it very difficult for patients to request and receive their own medical information. Some doctors are telling their patients that they are not eligible for MAID and are thus denied even a referral for assessment. In the cases I have seen, the doctors have been wrong. They have clearly not been familiar with Bill C-14 and the eligibility criteria. These patients have suffered unnecessary delays in receiving assessments and accessing MAID. I am only one of a number of physicians and nurse practitioners providing MAID in Ontario. I have no reason to think my experience and that of my patients is outside of the norm. This would suggest there is already lack of effective referral for MAID in Ontario. The CPSO policy on effective referral balances the rights of true conscientious objectors with the rights of patients to access a legal medical service. The focus should be on enforcing the policy, not eliminating or eroding it. For dying to be your first choice, the singular focus of your energy and attention, you must be suffering immeasurably. No one wants to die unless living is a worse option. Likewise, no family member or loved one of someone choosing MAID wants to see their person die. They choose to support the person they love and care for because they love and care for that person and want what is best for them from the dying person's point of view. It takes great courage to choose MAID, and it takes great courage and love to support someone through the MAID process. We should be supporting our patients and their families at this difficult time in their lives, not making it more painful, more filled with anguish, uncertainty, negative judgment, and neglect. Thank you.
Thank you. We'll start this round of questions